Good morning, good afternoon, good evening, wherever you are. Lillian DeFries here with Alive in Healthcare, and I'm so excited to be talking today about building professional communities in healthcare. I want to talk a little bit about why community connections are important. First of all, being part of a community can have a positive effect on our mental health and emotional well-being. That is key right now, especially in healthcare. Our mental health and emotional well-being is in dire need of support, and communities will give you that. I'm a strong believer in community involvement because it provides a sense of belonging. And if any of you have ever read the book Community, and I'll bring it up here, by Peter Block. This is Community: The Structure of Belonging by Peter Block. This is an old book, and as you can see, it's been read through and notes and highlights in there. And I really recommend this because it is talking about the importance of belonging. And what he talks about in belonging is to be related to and a part of something, right? We all need to belong to something. Tony Robbins has this, what he calls his 6 human needs, the 6 human needs that we have. He talks about certainty. Community will give you certainty in the sense that it will be clear on why you're there in that particular community. It will give you a variety. So, well, depending on how many communities you're part of, variety is really a key as well, because you're looking at communities that support you in different ways. There's also significance. You're significant when you're belonging to a community because you are part of a bigger purpose, or the purpose could be just about you, right? And the people in your group, which is fine. That's also building community for self growth, right? Which goes to one of his other uh, needs, Tony Robbins' 6 needs. He talks about connection and love, which you get there. He talks about growth. That is huge. Those are our spiritual needs, and contribution, how we may be contributing. So let's talk a little bit about maybe, belonging, first of all. That's not left by chance, as according to Peter Block talks about that. Let me just read what he says exactly. Peter Block says, belonging does not have to be left by chance. Hence the word structuring, which means to build, to construct, to form, the embodiment of creations. A quest not only for form, but also for purpose, direction, and continuity. So that's one of the reasons to belong to community. He also talks about the Bornstein-Cohen insights and says that changes that begin on a large scale are initiated or imposed from the top and are driven to produce quick wins, inevitably produce a few lasting results. Whereas sustainable changes in community occur locally on small scale, happen slowly, and are initiated at grassroots levels. So let's just talk about why I brought this subject into today's live stream. Building professional communities in healthcare. Our healthcare system is broken. There are many pieces to it, and there are many communities within the healthcare system. The challenge I have with that is that the communities that are in the healthcare system are not working together to create strong communities as they are meant to be, to belong to a community. So I take a look at, for example, let's take a look at the RN associations throughout your states or provinces, or the RNA or LPN, RPN, LPN, whatever we call them, wherever we are. There are associations there. There's a medical association. And I have been to these associations. I've been to their conferences, and there are a lot of bickering about the others, about how doctors complain about working with nurses, nurses complain about working with doctors, RNs complain about working with LPNs, LPNs with RNs. It's just constantly the bickering. That's not what a community is. That's an association. That's where we get support in certain ways, but they're not communities. What I'm talking about is belonging to a community that has a purpose, a very clear purpose for the people in the community. And I'm not saying associations don't do that, but when you become part of a community, you're becoming part of something that you are proud of, that is helping you on a personal level, and that you want to contribute to. The reason I talk about this is because my experience throughout the years has been that when I started to do my personal work, when I started to work really on my growth, my personal growth, I needed the support. And that's what communities gave me. So I started by joining a community of coaches. I mean, that was my profession. And when I first started, way, way back in my first couple of years of coaching, I started with a community. I'd started this group actually and said, let's get coaches together and help each other build our business. The only thing was that it ended up turning into a 2 years of people coming into the group, including myself, right there. I mean, I was the one who created this. We came into the group and we were complaining about how difficult it was to get clients, how difficult to be an independent entrepreneur and market ourselves. And so for 2 years, I was going, I really like the camaraderie about this group, but it's not getting me anywhere. So I stopped that community and I said, why are we hanging around people who are agreeing with us, who are holding us back, saying, yeah, let's justify why we are where we are? That wasn't working. I had to create a community or find a community of people that were going to support me with my intention. What was my intention? To grow my business, to become a better coach, to learn from others, to coach each other. Those were the things, that the criteria. So I recreated a new group with coaches that I had trained with and coaches who were successful. And what that did was it gave me the variety that I needed, as Tony Robbins talks about human needs, and gave me the strength of what are they doing that's working that I could learn from them. And they were in the same way, what was I doing that was going to help them. So our community, and after 27 years, I think, that I've been coaching, after 25 years of building this, we're still together. We're a community that reaches out individually to each other or meet as a group. Another community I became a part of was when I did my leadership training in Spain. So this was a year-long program, and it meant that we were in Spain 4 times in the year, in 10 months, actually. And that group worked on our leadership skills. We did different leadership growth things when we were on our retreats. And we created a community of, they were not all coaches. There were coaches. There were people who were, in personal businesses. There were all sorts of people in there, working employees. But we created a very strong group of 12 leaders. And to this day, years later, we meet on a monthly basis and we bring in leadership skills that we present to each other. We take turns co-leading our group so that we are co-leading together. So we're staying on purpose of why we got together in leadership. And we are also spending some time to build our personal relationships together. So we sometimes meet personally. We go on a yearly retreat together to build our relationship. And that is part of the agreement of that community. This all, for me, was extremely important. I felt that whenever I wanted to accelerate in a part of my life, whether it was professionally or personally, I found a community to support me. It was a place I felt that I belonged. And it was also maybe a place to start creating something. So that's when I started creating my own community in my business with Alive in Healthcare, called Join the Movement Nurses Reclaim Life. That community is a strong global community because it was my mission to bring nurses from all over the world, is my mission to bring nurses from all over the world who support each other. So I'm giving them the platform where they can share, they can listen, they can acknowledge, and they can empower each other. And the key to this particular community, because we're very clear on our mission, is to share our wins, to celebrate the great things that have been happening on a daily or weekly basis, but also a place where we can bring in a challenge that we're having and saying, I'm really having trouble finding a win here. I'm really having trouble moving through this. And the community comes together to give ideas, not tell somebody what to do, but maybe offer. And this is where part of the community offers, bring what you can, offer what you can, ask for what you need, which is very clear in that community. And we will find ways to share what we've done and what has worked or not worked. So it's a place for us to build a support system, camaraderie, but also move us forward in our profession. There are times when in nursing, the nurses come together, whether we're nurse managers or bedside nurses or whatever kind of nurse we are, travel nurse, doesn't really matter. We come together and say, here's my struggle. Here's what I've been doing. Here's what's working. Here's what's not working. And by sharing all that, it makes life a lot easier for the rest of us who are going through similar things. And it feels good. You remember I talked about the sense of belonging. It feels really good to belong to something, to belong to somewhere where you're helping others, because we have that need to create connections and to be of service to others. That is a strong human need. So this gives us that need. So that's how I built this community. And there are rules that happen when you're building a community. You want to make sure that those rules are clear to people. So there will be things like we consider this time a sacred space that honors all unique individuals emerging into our tribe. So that is really about a reminder that we are all important. And if you go back to the community book with Peter Block, he really talks about the importance of all voices that need to be heard. Smaller communities give us that opportunity. When we're in a healthcare system, it's sometimes hard to hear to have our voices heard. But to be in a smaller community is a place where we can do that. We can create safety and we can raise our voices. And then that's the place where we as a community can help someone say, how can we help you get your voice into the system that you're in, which is a bigger system? Or how do we create changes around that? So active listening is really important in a group. That's part of what I've created in Join the Movement, Nurses Reclaim Life. It's important to listen actively. In other words, when we're listening, we're not listening to be ready to reply. Okay? Often, if you have strong active listening in a group, there will be pauses when that person's finished talking so that people reflect and then the next conversation comes up. This is important. This is also a great place for people to learn how to be in larger communities. Because remember, when you start to be that person 24/7, you're also role modeling it in bigger places, right? We in this community, we realize that silence is precious. We talk about that, so that we allow personal integration, groundedness, and engagement. Our community forms a container that can hold conflicting viewpoints, so we don't all have to agree, right? And diverse perspectives. And one of the trainings that I have is all about worldviews, which is all about perspectives. And so that's the strength that I can bring to the community as the facilitator or the leader of this community, because it allows us to share from different worldviews. Okay. Sorry, my mic wasn't beside me. I hope I was okay there. Let's see. Yeah, and the things that have to be clear is what is our mission as that community? What do we value? What is our vision? How many people do we want in this community? Are we trying to grow it? Are we trying to do sub-communities? Do we want to train people to start leading their own communities within a community? Those are all questions that you want to ask. But I want to go back to building professional communities in healthcare. One of the things that one of the groups of people that I've been working a lot with are nurses and nurse leaders. Nurse leaders, so formal leaders in healthcare, let's just go there. It doesn't have to be just nurse leaders. It can be formal leaders in healthcare. Tends to be a very solo job. We think that, we need to have it all together, and that, Joe over there and Sarah on the other side, who are also solo leaders, all have their stuff together, and we're struggling. One of the biggest things we've done, or I have done through with my associates in my organization, has gone into healthcare communities, healthcare systems, hospitals in particular, and said, let's bring all leaders together to form a monthly group where we have done some training, some teaching, some coaching in groups to teach them some basis of how to be in community, how to be stronger leaders, etc. And then we go into a platform where there's 3 months of teaching the participants to be co-leaders. Okay, so we as the trainers or coaches step to the back of the room and now allow the leaders to start leading their own groups so that there's sustainability. We want the groups to create their own communities within the hospitals, within their organizations, so that they can continue running this and we can be there of service or support on the outside at that point. But for about a year, we run these monthly groups and help them to see how we lead, what it takes, what the expectations are, give them the sense of building, agreements together, what they want more of, less of in this particular group. And they may not call it a community, but really is a leadership group, right? But that's a community. There was a time when I went into an organization years back, and I remember going to the chief nursing officer. This was in Ontario, and I gave her the idea of starting some groups with LPNs, so RPNs they were called in Ontario, and a group with RNs, and a group with nurse leaders, and a group with physicians, and creating these groups of leadership, and then eventually merging them together. So giving them first the foundational process of being together. Then we would take one from each group, create another group, etc., and move forward. And she just thought this was brilliant. And it had worked, and I'd done it before. However, when I asked that her administrative team, so chief nursing officer and her team members, come into these groups creating as well, she said, "Oh, my group would never do that. They don't want to be that vulnerable in front of others." And I'm like, well, if you don't step forward as a leader to role model this, how do you expect others to do this? So just a key point. Really, it's really fascinating how people can see the benefit for everyone else, but when it's themselves, they back out. So think about that. Think about maybe it's not the time to integrate all people together in a healthcare system yet. Start with your common groups. What do they have in common? They're all physicians, they're all nurses, or they're all RNs, and they're all LPNs, whatever. And then eventually time will come when they'll start integrating together. That's the key. That's, if you take a look at Margaret Wheatley's work, Margaret Wheatley is a fabulous author who talked a lot about building community and the importance of having just conversations. And that's what this leads to. Okay, we may bring in some topics into leadership, but the goal is to open up conversations so that people can start voicing who they are, what their beliefs are, how that's working for them, how they might gain learning to create a new belief from other people in their group. It just opens up so much more possibility and positivity when you can create these communities. And I'm here to help you. If you want to start building a community in your organization, get in touch with me. Let's have a conversation about what that looks like in your community and how I can help you start that. Okay. Really important. I want to go to another community that I recently joined that I'm really proud of. And it's a community that reached out to me, asking me what I was doing and listening to some of my live streams, etc. And the community, and I will be speaking to them next Tuesday morning at 7 a.m. Pacific time, 10 a.m. Eastern time. So next Tuesday, I believe it is May 9th. Let me just double check. Next Tuesday, May 9th at 7 a.m. Pacific time, 10 a.m. Eastern time. I will be speaking to this group, and they are called Nurses Transforming Healthcare. I will have 3 guests on. There'll be Leanne Meyer, who also does a podcast. There will be John Silver, who's a very key person in this group, and Kathleen Bartholomew, that some of you may have heard of, who's also an author and speaker. And these people came together to create this group. And I don't want to talk too much about it, but next week we will have a discussion about how they got this group started. So they created this community, more of a group that's focused on transforming healthcare in the United States. But, even though I'm Canadian, why did I join this group is because there's so much to learn from other people who are doing things in healthcare. To me, I have a mission to be working directly with the nurses to help support them through their challenging times, how to have a better day, a better shift, a better life. And it's important for me to understand all the components of healthcare. So any opportunity I can have to listen to someone who's doing something that is maybe not related to me is important. However, Nurses Transforming Healthcare is related in the sense that I work with nurses globally, which means that it's important for them to work with me or be part of my community for the support they need on a daily basis and to get their life together. Whereas part of also being a nurse is creating a community that's moving towards solutions. And that's what nursestransforminghealthcare.org is all about. It's about transforming healthcare. It's a new way. It's not taking what is in existence and trying to fix it, but it's taking something and recreating. And these three brilliant minds together, including other people who are on the team that couldn't be part of that conversation next week, but you'll get a sense of what brought them together, what their purpose is, what they're doing, how they're changing things already. And it's fascinating. It's great. And I will be speaking at one of the conferences that Leanne Myers put together called Power Up Nursing in Florida on June 22nd to 24th. So you can see where even building a community with nursestransforminghealthcare.org to now speaking at Power Up Nursing Conference, like we're creating communities, pockets of communities that come together and have conversations that matter. Wow. Communities have conversations that matter. There you go. That's something really important. Now, we can be part of a community because we are looking to get something from the community for ourselves. Or we can be part of a community because we have a bigger purpose. So you might be wanting to build a community in healthcare that says, how do we support our nurses more? So there's a community in South Africa that I worked with who wanted to know how they could support their nurses on the floor more. So we created this little community, and this is a community that meets together, and they are part of Join the Movement, Nurses Reclaim Life, because now they want to continue the conversations. They want to continue looking at the positive things that people are doing. They want to continue creating possibility in their workplace and joy, right? So I talk about this in other live streams where I say happiness is circumstantial. You'll be happy when, right? You'll be happy when the healthcare system has been resurrected. I don't know what the word is, or fixed, or or changed totally. Or you'll be happy when you retire. Those kinds of things I hear all the time. But joy is more about an attitude that defies circumstances. And when you join a community, you take on a new attitude. You do. You can't help but do that. You take on an attitude that says, I'm in this community because, and everything starts to manifest from that belonging to something, from that purpose that people are creating. So you may be getting something out of it, but you may be also in a place of community to offer. So in the sense of nursestransforminghealthcare.org, this is a place where I can offer something to the group by saying, this is a possibility for nurses that I'm working with to know that there are solutions looking to be created. And this is one community could be a part of to help them create this way of transforming healthcare. So it's important to work together. That's the root really of, communities working with other communities and belonging in a community. I think it's so powerful. I know I would not be where I am today if it were not for the small pockets of communities that I belong to. I create my opportunities. That's through a community. I have a small community at home. I have my community, my family, which is a small group of people, but they're people who are, my family is there supporting me in my vision, in my dreams, and giving me feedback on what they hear me say, or how I'm moving forward, or how I can do things differently. This is a community you could say they're just family, but I look at it as a sense of belonging in this community that is not only out there for themselves, but they're out there for everybody within that community. When I talk about voices being heard, a lot of people in groups that I've worked with feel that their voices are never heard. That doesn't matter how much they say, people don't hear them. Well, if you're in that place, it is probably even more important for you to find that community that will make your voice important, or to start your own community that will have your voice be heard. Find the reason why you want to find this community, why you want to bring this group of people together. And it doesn't have to be around healthcare per se. It can be around, a topic of personal growth. It can be about leadership. It can be, it doesn't matter what it is. Creating a community is so strong. I've got a client just the other day who's creating her community around this it's an app that I've discovered, and we talked about it because she wanted to do more walking. It's called Conqueror Challenges, and you have different places around the world on these challenges, and they give you an app where you go and walk. You have to walk a certain number of miles or kilometers, wherever you are. So you might do the Kilimanjaro, you might do the Camino walk, you might do something in Italy, you might do something in India. It doesn't really matter. You choose your part of the world and you walk this many kilometers. And so what she did was she found a group of people. So she did her own by herself, but then she found a group of people at work who wanted to do this. So she created a community of walkers, and you can say, what's that got to do with building communities in healthcare? Well, I'm going to tell you, it's got a huge impact on building your community in healthcare. You've got your support. You're going to find your people who understand what you're doing professionally, and maybe who don't understand what it's like to be a nurse when you're a physician, or vice versa. But they're creating communities where they can have conversations, deep conversations while they're walking, and they're creating the same purpose. They're on a mission to walk Kilimanjaro, or the state park in South Africa or whatever, right? But this brings together, what their purpose is to have deep conversations with people and to get their walking in. So those are creating communities. You can build professional communities, or you can build personal communities in your profession. So where do you believe you could create a community for yourself? I'd love to see this in our chat. What kind of communities do you think you could build, either personally or professionally? But let's talk building professional communities in healthcare. What part of a community would you want to be with? What are you looking for? Have you Googled it? Have you searched for it? Put it out in the chat and reach out to people on LinkedIn and say, I'm looking to be part of a community of nurses who, whatever it is, right? Who are in oncology, right? Or who are in palliative care, who have to deal with, deaths on a daily basis or a weekly basis. And how do we get past the emotions of those things? That's building a community within your profession. Or you build it to create more camaraderie around your healthcare community. So it might be something like, I'm looking for 4 doctors, 4 RNs, 4 LPNs who want to come together and start talking about how do we break down the barriers we have amongst our roles within the healthcare system. These are just people who believe that we can do this. So they have a common belief. They are looking to educate themselves through other people that they may not understand. I may not understand, when I talk about the relationship between a nurse and a doctor. If I'm sitting there with a doctor, I might learn something from their perspective of what they're experiencing. And I might also help them see why they're experiencing that. And not that it's, right or wrong. It just is what is there right now. And how do we help change that? Well, the stigma around, being a doctor or a nurse or whatever it is working together, we've got to change that. We've got to change our whole perspective on what healthcare is. We have to change our perspective on our roles within healthcare, and we need to start working together. I think the big piece that needs to happen is that high level management needs to be working with, our bedside care, our people who are at the bedside. I think that building communities of conversations around that are important. And as important as the agenda of maybe finding ways to be better together is the agenda of just, getting to the human part, which I go back to Margaret Wheatley, who talks about having those deep conversations, talks about, seeing the human, that each voice is important. I mean, this is, whatever books I'm reading, Margaret Wheatley, Peter Block, it doesn't matter. We're talking about communicating on a human level. And as long as we stay in our professions with our only our community and don't grow that, nothing's going to change. But we need to start with our community first. We need to be able to sit down as nurses, as I'm doing right now with a group of nurses, and saying, how do you start inviting other people in other professions into your group so that we can have deeper conversations that have meaning, not bitching and complaining about others, right? They and us. This has to stop, but it starts somewhere. So my question today is, how are you going to build a community in healthcare for yourself? You may be tired of seeing nurses because you've been with them all day, or doctors because you've been with them all day, or whatever, right? Or managers. But my call to action here is for you to really take that step forward in creating that community, because it will become bigger than people that you work with. It will become bigger for you, for them, and for your organization. Trust me, I really, truly believe that, because I've experienced, like I said, I'm still part of those coaching communities. I'm still part of the leadership community, with people who are, there was not one Canadian in my leadership in Spain, not one Canadian, not one American. I'm in connection with leaders who are living in Dubai, in Lebanon, in Norway, in England, in Germany, in France. These people have all come together to create wisdom that is obviously coming from different worldviews, where we experience different things coming from different countries. So why not share that? Why not look at different perspectives? When I was speaking to a nurse in South Africa, and I hear that, they answer the phones, they don't have a reception. They're the ones who sometimes are carrying, pushing patients as a porter, let's say, I should be saying that, pushing patients to tests and exams, that they're cleaning the units. They don't have a cleaning staff that comes in and cleans. Like, they're doing much more than we are in the States or in Canada. And, so their perspective on things is very different. It's the appreciation is bigger because it's not expected. Our Western world of thinking in our, African or European or whatever is different. And it's good to learn from others. It's incredible when you hear other perspectives, other voices that matter, and be open to not judgment, but, wow, there are other things going on around me that may help me see things differently. That's what communities do. It's also that place of, I feel like I belong to people who care about what I think. That's so important. Each one of us here has something to say, has something valuable to add, has something that's going to change the world, our healthcare system, our neighbor, one person in our group. It doesn't matter. We need to take responsibility for that. We need to take ownership for being part of a community, whatever that is. So your communities can look different. It can be a community that's out to help, the patients who are not getting the health care they need. They're getting more disease care versus health care. So that's part of what I see Nurses Transforming Healthcare doing. nursestransforminghealthcare.org. I just want to make sure about the org. They're doing things for communities that aren't getting the health care that they need. And they'll share that story next week. I think it's really important. But I want to invite you to next week's call to learn about how they work as a community, how they got together, but also because it's something that you might want to be a part of, or you might trigger a thought of how to create a community of your own, or look for a community in your area that's already doing something similar. So there are tons of groups that you can reach out to. If you want to start outside of healthcare, you can go to meetup groups. Okay, there are some good meetup groups. There are some really bad meetup groups, but meetup groups can be great in the sense that they build a community of like-minded people who are looking for the same thing. So I've joined a coaches community group through Meetup. I'm thinking of others. There are walking groups. There are cycling groups. There are people who talk about neuroscience. There are, there's so many different kinds of groups, but you really have to define why you're joining or why you're creating this community. Is it to create an outcome that's outside of yourself, outside of that community you're creating, that group? Or is it something to help the individuals in the group? I mean, you want to be really clear on what the intention of the group is. And it's important to get to know people on a personal level. I've seen it over and over and over and over again. I can't say how many times that I've seen it actually almost like a research that was done. I was working in an organization many years ago where people were sitting on one side of the office, and then there was another group sitting on the other side of the office. And you could tell that, we thought, or, this group would talk about the other group as if, they were different from us. And then that would happen the same way, the other way around, because I was supervising both those groups. So I could tell what was happening. There was camaraderie going on here and their own over there. And then the whole place got revamped and restructured. And so the teams got all mixed up. So people from that side were mixed with people from this side, et cetera. And it changed everything and the dynamics. And then all of a sudden you start to see that the people that are here are creating their own group think, if you like. They're creating their own communities versus the other community. It's so interesting how just when you include somebody in your group, they become part of your group. When you don't include them, they're not part of your group. And I mean that in a way that's the way we think, not the physical part, but more about the way we think that people belong or they don't belong. Hence why I say we need to start mixing. What is wrong with me sitting down with the CEO of the hospital? Like, why is the high executives not mingling with the front line, and the front line not mingling with the upper executive? I think it's really important that we start to change that, that sense of belonging, really is what I'm talking about. So what's the thing that we can do that dares us to be different, dares us to start the communication with people who are not in a common area, but we might start creating or throw an idea. If I was sitting there with the CEO of the hospital, I might say, you know what, this is great. We're having a great conversation. I'm a frontline nurse or, a nurse manager, whatever, and we need to have more of these conversations. Why don't we create these maybe Tuesdays together where we all choose to sit with people we don't know in the cafeteria and start to have conversations about who we are and how we see things? Wow, would that not open the door to possibilities? I think so. But, I start small. I'm not saying today you got to go sit down with the CEO of the hospital or you as a CEO need to sit down with, a bedside nurse, but that would certainly be a great place to go. But maybe start small. Start by, even I look at, what was it? One of my clients who was actually saying she was going to be working with somebody that she didn't really get along with. There was some animosity between the two of them, but it wasn't really clear why. So she decided that she's going to have a coffee with this girl to sit down and say, who are you? How can I get to know you better? and let me introduce myself and who I am. And maybe we can get to know each other on a personal level. The possibilities of growing, and that's just building a small community. You can call it a community, you can call it a, um, two people getting together, but you're starting a community that has a sense of belonging for both of us, right? So communities can be seen in different ways, but I'm talking more today about the bigger communities that you can be a part of. So throw your ideas in chat, pass this on, share it. Let's start talking about how we can build communities, or a community that you might want to be a part of, and start brainstorming together in the live, in LinkedIn. Reach out to people who are in different roles and say to them, I'm really curious about your role and what how you see us as nurses, or how you see us as nurse managers, or how you see, how can we help you to do your work better? Like what, as physicians, what are you doing? Where are your struggles? And how could we as nurses help you? Right. So it's creating whatever needs to happen in your life. And you know what that is. You know what you need, where you want to belong, and you know the differences you want to make. So join me next Tuesday at 10 a.m. Eastern on the live stream, and you'll meet Leanne, John, and Kathleen, and we'll tell you more about a particular community that's working really well. Have yourself an awesome day, and we will talk to you soon. Bye-bye.